The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Mercy Medical Center and Studio Arts and Glass, and of course in the studio with us is technical producer J.D. DeAngelis. This morning in the studio with me is Brad White, a compounding pharmacist, and today we're discussing CBD oil and many benefits it can offer.
All right, good morning. We've had a lot of questions about CBD in the pharmacy, and as you drive around town and see signs everywhere from on telephone poles to gas stations and video stores, it's got to make you wonder, okay, what's the deal with CBD? So we're going to talk about CBD this morning, and we're going to talk about what kind of product it really is, what you should be looking for, and why it's important to find a source that's of high quality to get benefits for the body that you want. So just as a reminder, you can subscribe to our podcast. You go to your smartphone's app, and you can look for our podcast, Health Matters with the Medicine Center Pharmacy. Please subscribe to us, and we'd love to have you join us each week.
Okay, so let's kick it off. And what is CBD oil?
Well, CBD is cannabidiol, and what it is it's a non-intoxicating cannabinoid found in cannabis. It has many potential therapeutic benefits, including anti-anxiety, anti-inflammatory, and anti-seizure suppression properties. What it is, it comes from a plant, it comes from hemp, and it does not have psychoactive properties, which means CBD is not the same thing as medical marijuana. So CBD has a profile of cannabinoids in it that can help support the body's endocannabinoid system, which we can talk about. But medical marijuana actually has high THC levels, which is the psychoactive product, which can get you high or hallucinogenic effects. So they are two separate products, even though they come from a very similar plant.
So, what about explaining the difference between industrial hemp and marijuana?
So marijuana is cultivated to be high in THC, which is the psychoactive compound. Industrial hemp is a product that is legally allowed to be grown in the U.S. as of the Farm Bill that passed last year, and it is something that's cultivated for a high CBD profile and a low THC profile. So CBD comes from industrial hemp, and by law it has to have lower than 0.3% THC in it. So in full disclosure, CBD products that are full spectrum, and we'll talk about the types here in a little bit, but full spectrum CBD products could have a trace of THC in them. It's less than 0.3%. It's not going to get you high. It's not going to be psychoactive. It's not going to impair your driving. But it is something that is part of the hemp plant, and industrial hemp is cultivated for purposes of CBD, not for medical marijuana.
Okay. So we're hearing, and I'm hearing, that CBD oil can provide significant health benefits. Specifically, what are they, and what ailments are they effective in treating?
Well, first off, a disclosure, CBD currently is not recognized as a medical treatment or a drug. The FDA allows it to be sold in the U.S., It's basically sold as a dietary supplement, but there are many therapeutic benefits which make it really belong in a pharmacy as far as I'm concerned. And the reason I feel it belongs in a pharmacy is because there are a number of different drug interactions that are possible, and it's important that if you're going to attempt to try and use CBD in your body, you need to understand if you're taking other prescription medications, it could be an issue. Now, that being said, there are some studies and research that shows there's possibility that CBD could be supportive of anti-inflammatory processes and anti-anxiety effects. Part of this is because of how we believe the researchers have determined that CBD works in the body. We have a series of receptors in our body that are part of what we call the endocannabinoid system. And when CBD stimulates these receptors, there is a potential for modulation of inflammation and pain, and also anti-anxiety properties based on how it affects your neurotransmitters, dopamine and glutamate releases. So because of how we believe it works in the body, acting on these receptors, there's really good evidence that there's support for anti-inflammatory, pain, anti-anxiety, and some other processes. But we have to be really careful about what we say CBD is good for, because I can't tell you that CBD is going to cure your pain, because it's not legally, we're not allowed to legally define it that way. But there's every reason to believe it could be supportive for health and well-being, and certainly has properties that are anti-inflammatory and anti-anxiety based on studies that are published today.
Where did this come from? I mean, the discovery of this item. Has it been known for years, used for years, or what? There's
significant study that's been done on marijuana proper for years, back into the 60s and 70s. And one of the things that has been discovered are these CB1 and CB2 receptors, where both THC and now CBD have influence on. And I like to give the analogy at the seminars that I've been giving in the last 6 months that, a receptor in the body is kind of like a keyhole. And drugs or prescription drugs often affect receptors. And so in this case, CBD is a supplement or a natural product that has a key-like shape that when you put it next to this lock, which is the receptor, it doesn't necessarily perfectly unlock the lock. But everybody probably has a key at home that's really worn down, and you can kind of stick it in a lock it doesn't belong in and jiggle it, and you sometimes can open that lock. Well, CBD and THC both have effects on receptors, and as a result, they get a response in the body. And that's where we believe that some of these anti-inflammatory and possibly anti-anxiety effects can happen. And so more studies are currently being done, but in the late 80s, we started to learn a whole lot more about CBD and THC profiles and how they affect the body. And in the beginning, the research was heavy on medical marijuana and THC because of the psychoactive properties. And that research led to other discoveries about other parts of the plant. And that's what's been really fascinating, because we have this whole system in our body. You're familiar with the respiratory system, or your digestive system, or your cardiovascular system. Well, we have what we call an endocannabinoid system, and it's this giant system of receptors in our body that can be stimulated by CBD and also by medical marijuana or THC. I didn't learn about it in pharmacy school. Our physicians didn't learn about it in medical school. So it's something that we're all kind of playing catch-up on, and it's one of the exciting reasons that medicine can be so fascinating, and there's always new discoveries, and it's important to be well-read and keep up.
The hemp, excuse me, the hemp plant has some pretty interesting things about it. It's called a cleaner plant.
This is true.
What is the deal here?
And this is a really good reason. It's a really good reason you need to know where your CBD products come from. Industrial hemp is, my analogy is, it is the catfish of the plant world. Whereas catfish are the bottom feeders, and they're exposed and eating everything on the bottom of a lake. So if it's polluted, they're going to be sucking up those pollutants. Hemp, when planted in the soil, it actually absorbs properties of the soil around it. One of the things they did at the Chernobyl accident was they planted industrial hemp in that environment with an attempt to soak up the radioactive and the polluted soil and air and things of that nature. So it's very important that you make sure that if you choose to use a CBD product, you find out where it's grown, and that it's you make sure that it's grown in an organic, pollutant-free environment, and that it's tested for pollutants. Because once a hemp plant is exposed to pollutants, whether it be heavy metals or pesticides or pollutants, it is going to be part of that CBD profile. It's going to be very difficult to separate.
Okay. So there's many types of CBD, and full spectrum tinctures, creams, etc. Oral product, I think it's available in capsules and maybe even tablets. What about the differences?
There are a number of different forms. As you mentioned, there are tinctures, which are like an oil product where you'd administer it in a dropper under the tongue. There are capsules, which you'd swallow orally. And there's topicals, creams, salves, lotions, ointments. And there's even inhaled smoked products, which I can't get real excited about given some of the dangers we've learned about vaping lately. But there are inhaled products out there, too. So those are some of the forms, and they can be used for different reasons. And one of the things that I've discovered is that people that come in the pharmacy and ask questions about CBD who've tried other forms or other manufacturers, sometimes if they don't have a response, I'm finding they aren't using necessarily the right form for trying to address the condition that they're concerned about. So maybe after our commercial break, we can talk about the different forms and how they apply in different areas for CBD use in the body.
Okay. First break is here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Men like Paul White love Studio Arts and Glass. Why? We wrap all of his gifts. Gifts like hand-blown paperweights, ornaments, jewelry in stunning sterling silver and precious stones like amethyst and crystals. After 30 years, Studio Arts and Glass is known for creating and restoring stunning stained glass. Just ask Paul White. Studio Arts and Glass on Apple Grove and 77 in North Canton.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are discussing CBD oil. Have a question? Post it on our live Facebook feed. So, our pharmacies sell Imbu products. Why do you feel they are the best brand of CBD?
Well, we like Imbu Botanicals for a number of reasons. Part of the reason was what we talked about before the break. They have this neat little barcode on the back of their box, and you can scan it with your phone's camera, and it'll take you to show you everything that's happened with that product. It'll show you where it's grown. It'll show you when it was harvested, how it was packaged, who tested it. it basically gives you the life story of that product in the box, which is really fascinating to me as a pharmacist because we don't have that good of details on our prescription drugs at our fingertips. We have the ability to do some digging into the weeds and find out where everything came from, but it takes some work. So it's important, I think, that the company has taken the level of effort that they have to fully disclose everything about their product, where it came from, who grew it, and how it was tested to make sure that you have the best thing in your hand. So I believe it's high quality. We've had wonderful success stories from patients and feedback for a number of different reasons. But you've got to think about a couple things. So you got to pick a really high quality product like Imbue. Their product is grown in Colorado. The company controls the whole process from when they plant the seed to when they put it on the shelf in our pharmacy. And the product's grown at 6,000 feet in Colorado, so you get an extra nice UV profile for that plant when it absorbs the sun at higher altitudes. And they make a full spectrum product. And we haven't talked about types of CBD yet, so let's talk about that. Excuse me. So they make a full spectrum product, which means they use the whole extract of the plant to get the profile of CBD. There's over 100 different cannabinoids in CBD, and sometimes what you're buying, you don't always get a clear picture of what you're getting. And what I mean is there's full spectrum, which is the whole plant profile. There is the isolate, which is one profile. So my example would be, think about a multivitamin. In a multivitamin, you have vitamins A and B and C and zinc and minerals like calcium and magnesium. That would be like the equivalent to a full spectrum CBD product, because that has all the profiles of different areas of CBD, just like a multivitamin has all different types of vitamins and minerals. An isolate product for CBD would be like one profile. So all it would have would be the CBD profile, much like a vitamin E is vitamin E. So keep in mind that not all CBDs are created equal, so you really got to read that package and look for the details. There's also a broad spectrum CBD is the third type of CBD. And the broad spectrum CBD is a full spectrum profile without any THC in it. So if you're a policeman, fireman, nurse, doctor, healthcare worker that gets drug screened at work and you want to have the benefits of CBD, but you don't want to have the risk of the small chance that you might test positive on a drug screen, you can use the broad spectrum CBD product, and that will eliminate the risk of you having any THC flag on your drug screen at this point.
Okay, so there are various dosage forms and various dosage recommendations. How do we figure this out?
Well, this is a challenge for a radio show and a challenge without a specific example, so I'm going to try to throw you a couple examples, but I'm also going to reinforce that when you're looking for a particular solution from CBD, this is why a pharmacist is your best bet. I believe CBD belongs in a pharmacy for a number of reasons, and dosing is one of them. Basically, the reason is a lot of different patients could take CBD for different severity. So, for example, someone who's come in and looked for CBD support for anxiety might have different levels of anxiety. For example, maybe they have anxiety every day when they go to work. Maybe they have it once a week. Maybe they have it once a month when they get together with their family. So depending on the severity of the condition you're trying to address is going to depend on the dose and the frequency with which you use CBD. So much like rheumatoid arthritis, I've had a patient who's had some success with that and getting support from CBD. This particular patient has problems on a daily basis from when she gets out of bed all day long until she gets back in bed. So her dose and dosage form is going to be a different recommendation than a person who maybe just has an occasional stiffness in the knee on a really cold morning like this morning when it's 20 degrees out. So dosing is an art. It's also something that needs to be tested. So what we like to do is we like to recommend in general that you start with a low dose and you go slowly. And it's going to take some time. So we all are, I'll speak for myself. I'm kind of impatient. I want quick results, whether it be for a therapy, a medication, or a weight loss plan, right? But you're going to have to give it some time. And I'm going to tell you that regardless of the dose you start at, you're going to need to give it between 30 and 90 days. and you're probably going to have to adjust the dose multiple times across that course. Because each dose is going to be kind of specific for your body type. It's also going to be specific for the severity of the condition you're trying to treat. And then maybe this is a good time to talk about dosage forms with respect to that. So the neat thing about tinctures is it's very flexible. So in the spirit of titrating your dose from a low dose to a higher dose, you can do all kinds of customization with the tincture. So you could use, it comes in an oil, and it basically you dose it by a dropper. And it could be a couple drops to a half a dropper full to a full dropper full, and that's the beauty of a tincture. You can kind of move it all over the place. You could also dose it more than once a day. So a tincture is generally going to last you between 2 and 4 hours of duration for effectiveness, whereas capsules, if you take a capsule, you're going to get duration between 6 and 8 hours. So you get a longer duration, but capsules you get fewer dose choices. So with the doses we carry, you get between 5 and 25 milligrams. So that's one of the things that maybe as you figure out your dose and you figure it out on a tincture, then you could move to a capsule and you could get longer duration with fewer dosings. And even more, and just as flexible as a topical salve. So with my example earlier about arthritis or a stiff knee, topical ointments are fabulous for just applying right to the spot you're having pain or an issue. You can put it right on there and you usually get effectiveness within a half an hour, and it'll last about 2 hours or so. So depending on the dosage form, you get a range of different length of duration and a difference in how customizable the dose is.
I think it's interesting that you can use these products when needed. You don't have to take... this probably isn't an analogy, but if you take prednisone for an ailment, you have to build it up in your system and maintain it with a lower dose. These products, CBD products, apparently don't sound like that's necessary, that you can use them on occasion when you need pain relief or when you need anxiety relief or whatever. Is that the case?
It very well could be. So how about this? My example of maybe you only have anxiety once a month if you're going to meet your family for dinner or something. You could just use it for that event. You don't have to use it the whole month. So you're right. It can be very flexible. You can even combine products and use orals with topicals. So the great thing about CBD is a lot of different dosage forms, and it can be customized to the situation you're trying to address.
Okay. Bottom of the hour, time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, this is Brad White from the Medicine Center Pharmacy. If you have sore muscles or aching joints, you may want to consider a prescription pain-relieving cream available with a prescription at the Medicine Center Pharmacy. Our pharmacists can work with you and your physician to get topical pain creams that can be rubbed directly on the source, reducing inflammation and pain. Topical creams avoid troublesome side effects and dependency issues that can be caused by oral medications. The Medicine Center Pharmacy has an accredited compounding laboratory, and it is your source for custom medications. Custom compounded pain-relieving creams, available only at the Medicine Center Pharmacy, where wellness begins. Visit us at medshoprx.com for the pharmacy nearest you. That's medshoprx.com.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia.
Are you tired of spending time sorting your medication? Hi, Pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
We've extended our most recent sale at the Half Off and Hot Buy store in Louisville and have added a lot of new items. All lift chairs are reduced to $199 with many in stock. All seasonal merchandise is drastically reduced, as well as a wide selection of health and beauty products, cough, cold, and vitamins. And shop our tool aisle and toy aisles to find more bargains. Take time to shop our store and you'll find many, many values. The Half Off and Hot Buy store in Louisville, next to the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today, Brad and I are discussing CBD oil and pharmacy services. We have a lot more to cover this morning, so let's get back to the show. So we are at CBD products for pets.
CBD products for pets, yes. That is a popular and growing area, and it's one that probably needs some additional study, to be brutally honest, but I do have owners right now that are telling me that they're seeing success in their pets with a lot of different things. Sometimes it's anxiety or nervousness. The classic example I've been told is the fear of storms and fireworks and things of that nature. Patients, I keep saying patients. Our pet patients feel that they get some benefit from those anxious situations where they may be on edge, whether it be a storm or maybe nervous around visitors to the home that they're not used to. But there's also that underlying benefit of anti-inflammatory potentially that we talked about earlier because of the mechanism of action of CBD. So I can't give you a lot of good information at this point about arthritis for pets, but for dogs in particular, there is some studies that are going on right now that possibly will show great benefits for CBD and arthritis and things of that nature. But that's under development, and it could be an issue. But I would encourage you to talk to your vet about CBD. We're at a little bit of a disadvantage in Ohio. You may or may not know, but we've only really been legally allowed to sell CBD since about last August. So a lot of the things that pharmacists and professionals like myself are doing now is we're working with other providers from other states who've had the ability to sell CBD and interact with it with their patients for a longer period of time. So we're all on a learning curve, so I would encourage you to ask good questions. I would also encourage you to ask questions about drug interactions, and I wanted to touch on that before it gets away from me. Many patients are taking prescription medications that are metabolized by the liver. And I'm going to give you an example that might resonate with a lot of people, and one is a statin drug. Statin drugs are used for cholesterol. They're one of the most popular treatment therapies for patients with cardiovascular disease and diabetes. And statin drugs like Lipitor, Zocor, those are metabolized in the liver, and CBD is metabolized in the liver. So there's a chance that your dosages of both could be affected if you take them at the same time. I'm not saying you cannot use them at the same time. What I'm telling you is to talk to your pharmacist and make sure that the doses you're looking at are safe and that you have appropriate liver function to tolerate the condition. And that's why I feel that it's important that you talk to one of us at the Medicine Center and one of our pharmacists about CBD usage and make sure that you get all the information before you go in blindly and try something. We wouldn't want you to hurt yourself.
Statins are usually taken in the evening or before bedtime. Is that not correct?
That's true, yes.
And so here you are with CBD, and in your waking hours, you would want to use that product. So it seems to me that morning doses of that or early in the day would not get in the way or fuss up, shall we say, statins.
It could be possible, yes. Don't get me wrong. Overall, CBDs are very safe. There's studies out there of patients taking 1,500 milligrams a day and not having any overdose complications or any side effects, okay? But just keep in mind that much like if you take too much Tylenol and your liver isn't up to par, maybe you have a liver condition, it's that certain doses of certain medications, when they have to be metabolized for elimination by your liver, it could have an effect on your overall body's blood level. So that's where we're going. But drugs like statins are generally dosed during the evening. But drugs, some of the anti-anxiety or antidepressant medications, like a Prozac or Zoloft, those are also metabolized in the liver, and you'd take those in the morning generally. So, again, you can use them together. We just need to be diligent and make sure that you're going to be safe.
Okay. All right, we talked about this, I think, a little bit. But what about Imbue products tested by independent labs for purity and quality? Are we doing that?
They are, and the best CBD providers in the country right now are going the extra mile, because I guarantee you what's going to happen in the next 2 years is you're going to see more regulation by the Food and Drug Administration on CBD products and how they're marketed. And one of those things that the leading companies are doing, like Imbue Botanicals, is they are doing independent third-party testing, which means they submit their product to an independent laboratory, which they don't own or control, for evaluation before they make it into CBD. And they're looking for contamination like heavy metals, like mercury. They're looking for pesticides. They're looking for pollutants. They're basically looking for impurities. And an interesting analogy I think I can give is there are many patients who are really educated on using essential oils. And the highest quality essential oils have properties and flavonoids that give them their character. When you think of lavender or you think of peppermint. And CBD is not much different. Those plants are dependent on the environment around them, and if it is polluted in any way, shape, or form, it is going to come through in the product. So much like high-quality essential oils, high-quality CBD products need to be cared for and grown and cultivated in a fashion which is responsible. And that's a neat thing to see a company go the extra mile, because they don't have to do this. They don't have to do independent testing. They don't have to tell you where it was grown. And I think that shows the transparency that our whole healthcare system needs. We need to be able to see what happened along the line of a service or a product that we're getting and understand exactly why it's being done. And I guarantee you in the next 2 years you're going to see more regulation by the FDA. And I really believe a company like Imbue that we're using in the pharmacies is going to come out ahead of that.
So, more and more employers are drug testing their employees. Where are we on CBD oil and this sort of situation?
Okay, so a quick review of CBD and what it is. CBD is not medical marijuana. However, it could have in a full-spectrum product up to 0.3% THC. And THC is the psychoactive component of medical marijuana. So there is a chance, if you use full-spectrum CBD for long enough and a dose high enough, that you could be flagged for a positive drug test if you get screened at work. Right now, our drug tests aren't perfect. So it seems to me, from what I'm being told, that it's either a positive or a negative. It's not a severity. So it's not going to be able to tell if you took CBD for 14 months versus if you smoked a joint over the weekend. But if you do work in an environment where you want to get the benefits of CBD, but you don't want to have to even remotely worry about being flagged on a drug screen, what you could do is you can use a broad-spectrum product which has the THC stripped out of it to gain as much of the benefit from the CBD product as you could.
So, I know you've been hosting seminars recently about LDN and CBD Can you give us a brief introduction to LDN and what patients it is most beneficial for?
Yes. We've had some really exciting seminars over the last 6 months, and the next one's coming up on February 6th at 6:30 p.m. It's at the Hampton Inn Meeting Room in New Philadelphia, Ohio, at 1299 West High Avenue. It's right off the interstate there at 77 and West High in New Philadelphia. And we've been talking about low-dose naltrexone and CBD products. So if you want a more in-depth CBD discussion, we could talk. We're going to talk more on that Thursday evening in February about that. But low-dose naltrexone is an interesting product because it also has uses that complement CBD in a fashion where they could even be used together. Low-dose naltrexone actually is an immune system modulator, and it helps with autoimmune conditions through a couple different mechanisms in the body. It helps modulate the immune system, and it also helps reduce inflammation. And these two particular conditions in respect have a lot of applications to a lot of conditions. So an autoimmune disease, for example, is one like rheumatoid arthritis, fibromyalgia, Hashimoto's thyroiditis, psoriasis, multiple sclerosis. So all these conditions have an underlying inflammatory condition involved with them, and they all have some level of the immune system attacking our own body. And the great thing about low-dose naltrexone is there's over 1,300 published studies and research articles that help give support to treating and supporting different conditions like these autoimmune diseases. So if you have Crohn's, colitis, irritable bowel syndrome, fibromyalgia, rheumatoid arthritis, basically, if you have been to a number of doctors and tried a number of prescription medications and you're still suffering from pain, you need to come and talk to us and learn about this on February 6th. I really think it's something that would be worth your while. We have some great literature we're going to give you to share with your doctor, and it gives you the ability to potentially seek out a treatment solution that is perfectly legal and FDA approved, but it is also something that is really an up-and-comer in the autoimmune disease area. So it might be a solution that can give you some support that you haven't had at this point.
So you mentioned the dates. Any further down the road or scheduled or not?
My goal is to do one every month for the rest of the year. I don't have a hard and fast date set for March yet, so it will be. I got to figure that out here pretty quick. So, because I need to know by February. So we'll have a date in March. You just have to make sure it works with the venue.
Okay. Our final breaks here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshoprx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Men like Paul White love Studio Arts and Glass. Why? We wrap all of his gifts. Gifts like hand-blown paperweights, ornaments, jewelry in stunning sterling silver and precious stones like amethyst and crystals. After 30 years, Studio Arts and Glass is known for creating and restoring stunning stained glass. Just ask Paul White. Studio Arts and Glass on Apple Grove and 77 in North Canton.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival. saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Hi, Paul White from the Medicine Center Pharmacy. From 1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years, but one thing hasn't: our commitment to your health. Stop by your local Medicine Center Pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Thanks for joining us. Let's get back to the last segment of the show. Okay. So, we got to kick this subject over to influenza. It is circulating in the community. We know that. How can pharmacists help, our pharmacists help, if the customer believes they have influenza?
Well, I'm looking at the CDC's season week 1 ending map on their website, and, you know, their week 1 ended on January 4th, and this is the 17th, so their data's a little bit behind. And almost the whole country is red for high flu activity, except for little old Ohio and Illinois. Ohio is on the minimal side, and Illinois is on the low side, so it won't be long for us. There's a couple ways. If you haven't gotten a flu shot yet, get it today. I mean today, because it's going to take a week or two to build up, and you're running out of time. We have flu shots available. Walk into any pharmacy, and we'll fix you up, okay? On the flip side, we do have the ability to give you flu or strep tests. So, you know, one of the things that we're hearing from patients, we do a monthly test where you can come in the pharmacy and you can get your cholesterol checked, or your hemoglobin A1C, or your glucose, or even your TSH or vitamin D levels. But one of the things people tell us is that they're frustrated with how expensive their health plans are and how expensive it is to go to a stacked care to get tested. And everybody is very health conscious and trying to keep control of their health care dollars. I mean, why wouldn't you be? You don't want to spend too much. But you can come into the pharmacy and we can give you a flu test, and then we can give your doctor a call to see if you test positive. We can call your doctor and try to get you a prescription for treatment so that you minimize the exposure to the rest of your family and your people around you. So it's a process that can be done very affordably, and hopefully it can save you time, and you don't have to go sit in an emergency room setting where there's a bunch of sick people around you passing other bugs around. So don't be afraid to think of the Medicine Center if you need a strep test or a flu test. And, of course, if you don't test positive, that's great, but we can maybe recommend some over-the-counter medications for you to help you deal with those symptoms you're suffering with.
So let's talk about Shingrix for a second. I know we have plenty of flu vaccine. Shingrix has been in short supply now for a long time, but we are catching up or have caught up, or shingles vaccine is what I'm talking about.
Yeah, so shingles is probably one of the biggest questions I get from patients that come in the pharmacy. There have been enough TV ads and enough stories from family members, loved ones, or friends that people have shared some pretty frustrating experiences about having shingles, and people don't want it, and I don't blame them. A new vaccine came out a few years ago called Shingrix, and it has extremely high effectiveness and activity for duration of use. And as a result, the demand has been so high, it's been very difficult for us to keep up pace. We're happy to say that at this point in time, we have adequate vaccine available in the pharmacies for you to walk in and get a vaccine. And it's a 2-dose series, so you've got to get you get one shot today, and then between 2 and 6 months, you've got to get your second dose to get the full effect. But I encourage you, if you have not had your shingles vaccine, even if you had chickenpox, whether or not, you don't want to have long-term complications from shingles. The nerve pain can be very uncomfortable, and it can stay with you forever. So please consider getting vaccinated to save yourself some pain and suffering down the road.
Most insurance is paying for these injections, but what is the age limitation on this product?
Over age 50. And yes, generally it's covered on your Medicare Part D plan. It's a drug benefit. It's not a medical benefit. So I don't know who thought this up, but just for your clarification, your flu shot gets billed to Medicare Part B as in boy, just like your blood test due at your doctor or your doctor's visit. But for some reason, the shingles vaccine gets billed to your Medicare Part D plan or your drug plan, just like your blood pressure or your antibiotic. So it's a little confusing sometimes for billing. Commercial insurance generally covers it also. We've not seen issues with vaccinations in years. But, it is January, so it's deductible time. So keep in mind that depending on how your deductibles are set up, that may color your copay.
Okay. A few moments we can talk about easy dose packs. And I'm supposed to have an example to show here on the Facebook camera, but I didn't bring one, so no picture available. Each dose is packed in an individual easy open pack, so when you walk through the kitchen wondering if you remembered to take your morning meds, it's easy to tell. So these packs help with compliance, but also make it convenient to take doses with you during the workday, on vacation, or any time you aren't going to be home. So best of all, there's no additional cost for this service. Some places, some organizations, some stores charge you a fee. We do not. Give us a call, mention the Easy Dose Pack, and we'll be happy to dispense your medication in this format as opposed to a traditional pill bottle.
There's my quick and easy thing. There's my picture for Easy Dose Pack. So it's kind of slick because one of our most popular requests in the pharmacy is, how can you help me figure out how to keep my medication organized? And, when you start to take 2 and 3 and 4 medications a day, and you got to take one in the morning and one at noon and one at 4 p.m. and one at bedtime, it gets to be a lot. I mean, we're all busy. We're all trying to keep track of things. So the neat thing about these is it's a nice little strip pack, and they're customized by dose. So, if you're going to go off to work, you can take off Friday's pack, and it might have your morning dose and lunch dose and afternoon dose. You don't have to take all your bottles with you to work. It's no sweat. So it can be really flexible. We have patients that are in assisted living facilities or senior living that use these in their own residence. We have truck drivers that drive across the country, and they take their 7-day strip pack and take it with them. They like it because it's easy, it's labeled, and it's really functional. So it's something that we can even deliver to your home if you live in the community. So if you're not able to get out, our home delivery service is available.
Very interesting. We have a very, very large amount of our patient base on this product, and we get constant thanks for helping people take their meds on a regular basis and not forgetting to take their meds. Because if you've got more than a couple of medications you're taking, you have a couple of pill bottles, or even if you're taking vitamins or whatever, you got other bottles laying around there. And, some days you just don't remember if you took the medication. So what do? Double up? Doubling up's bad sometimes. Some meds maybe not, but most of doubling up is not good. So particularly if you're using products that for blood glucose, things along that line. So that's kind of the scoop for today. Anything else, Brad?
I just wanted to touch on a couple summary things. So, please bring us your CBD questions. I'd love to hear what you're trying to benefit from. I really believe in the next year or two we're going to see more regulation by the FDA, but I also believe that people are going to start taking CBD much like a multivitamin on a daily basis. I feel like there's reason to believe there's enough benefit out there that a lot of people can get daily benefits from it and how it affects our systems. Please think of us when you need affordable lab tests, whether it be a cholesterol test or a flu or strep test. And, our pharmacies are a great resource for helping you find solutions to answers, and we can make recommendations for products that our pharmacists believe in to help give you the best benefit we can and try to help save you some money. And I would encourage you to realize that you have the right to choose your own pharmacy. So if you want to talk about pharmacy choice, you come give us a call at the Medicine Center Pharmacy, and we'd be happy to help you.
Okay. Special thank you to our sponsor, Studio Arts and Glass, Mercy Medical Center, and our technical producer, J.D. DeAngelis. If you have a medical condition, please consult your healthcare professional for guidance. As always, thank you, listeners, for joining us on Health Matters with the Medicine Center Pharmacy.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.